So for a lot of patients, they always like to ask shoes like another sole, whether they can wear it or not. Looks can be deceiving. And the good thing about another sole is the softness of the upper. Hello, I'm Xing Jie, the podiatrist. I work in Singapore. A podiatrist is a foot and ankle specialist. We treat foot and ankle conditions like bunions, plantar fasciitis, flat feet, and also ingrown toenails. We provide non-surgical treatments for all the foot and ankle condition.
What does a podiatrist do, and why is foot health vital for overall well-being?
So a podiatrist treats a foot and ankle condition. We assess the foot, then we come up with a treatment program for the patients. Like example, if a patient comes in with bunion condition, we will assess and see what is the cause of the problem. Then we'll provide them like insoles, change of shoes, and also some exercises to help. So foot health is important because we use it every day. So we use it for our daily activities. So without good feet, it can actually cause a poor quality of life. That's what my patients always say.
What common foot problems do women face?
So among women, most commonly they come in for bunions. They also complain of foot pain like plantar fasciitis, and then they also come in with ingrown toenail or fungal nails.
How do these conditions develop?
So like for example, bunions, right? They are actually caused by excessive pressure on the big toe joint. There's a few ways that people do tend to put more pressure on the big toe joint. The most common is actually a poor footwear. So like shoes that are too tight for the feet. When the shoes are very tight at the front, they will actually press on the sides of the joints, and that's cause a lot of pressure. Look through to see if there's any hard skin or any extreme redness on the sides of the feet or any parts of the feet. So then if there's a lot of redness, then that means there's actually too much pressure on the area. So then that's where the bones actually had to change their position to actually accommodate the pressure. So that's why they start forming bunions. Over here actually, there's two types of bunions. The more common one is actually the normal bunion over here on the big toe joint. The other one is actually a bunion net over here on the fifth toe here. So the pressure usually from tight shoes are actually at the sides of the joints here. The other way of excessive pressure on the joint is actually the way we walk. Sometimes for some people, the alignment of the joints and everything is not ideal. So then they cause more pressure on the big toe joint, because the big toe joint is where we need to push off when we walk. When there's not an ideal alignment for the walking, they actually will cause more pressure on the big toe, and eventually with a lot of pressure, they start deviating and cause a bunion.
How does plantar fasciitis develop?
So plantar fasciitis is actually it's overstrain of plantar fascia, which actually runs from the heel all the way to the front of the foot. Very commonly, a lot of people come in with plantar fascia because of overstrain. One of the main things is actually increase in weight recently, or poor footwear for a long time, or poor footwear during their activities, like they wear unsupportive shoes for running. For all this high impact activity, we need something more supportive, because if it's not supportive, we may actually overuse our muscles and especially our plantar fascia, because it's part of the main structure that actually supports the foot. The other way is actually because of tight calves. So the calf actually, it links to the plantar fascia. So over here, our calf muscle over here, right? And then our plantar fascia is actually over here. When there's tight calf, they keep having that pulling effect at the back and cause a lot of strain on the plantar fascia. So eventually over time, they actually cause plantar fasciitis.
Is it common to have foot problems?
Yes, it's very common. Even for males actually, recently, they keep coming in with foot problems. And a lot of time is actually because of poor footwear.
What issues can poor footwear cause?
So for footwear, right, because usually we like to wear shoes that are fancy, that looks nice and more fashionable for the clothes that we are wearing. And a lot of the foot of the shoes, sometimes they actually may not fit nicely, in the sense that they may be too tight for them. And some people, they need more support, which some shoes may not have. So then after a long time of using this kind of shoes, like tight shoes, then that's where they start having problems.
Do women face specific foot issues as they age? At what ages do these conditions typically appear?
So a lot of females actually come in with bunions issues. and they can be very late stage bunion as they age, because usually people don't tend to think too much when it's a little bit of bunion. There are females that comes in with arthritis issues. Arthritis is wear and tear. So like I mentioned, our feet, we use it every day. So the joints keeps on moving a lot every day. So eventually there can be wear and tear. So as we age, that's where arthritis actually can cause a lot of problems. A lot of females, they come in with callus and corn. So like they are actually hard skins on the feet because of excessive pressure at certain points. With our walking, especially when the walking is not ideal, the pressure is not well distributed. So then there may be more pressure on certain parts of the feet when we walk. So that's where callus and corns can build up at that area.
Do women face specific foot issues for ladies in their 40s to 50s?
Yeah, arthritis, bunions, progressive collapsing foot deformity, which is actually the foot flattening of the arch. So that's very common in the older population, and also horn and callus. Yeah.
How do conditions like bunions and flat feet typically develop, and what can be done to mitigate them?
Actually, most of us are born with flat feet, and then our arch will gradually form around age 6 to 8. But there are people who don't actually have any arch, so then they are naturally with flat feet. That's what we call a condition like flexible flat feet, and usually they don't cause any problems. Other type of flat feet, like those that I mentioned just now, where they actually start having flatter arch when they are older, is actually because of overuse. The muscles actually get overstrained, weaker, that they are not able to support the foot. So that's why the feet starts flattening down. Sometimes it actually can only happen to one foot, not both. That's where we actually have to assess and see what's going on, what's the cause of the foot, which muscles are the ones that's overstrained, which muscles are weak. Have to recommend supportive shoes, like sport shoes, and then also insoles, special insoles for them to get the ideal way of walking for them, and also strengthening exercises to help them strengthen the weaker muscles.
Could you explain to us the anatomy of the foot? Where do people normally feel pain?
So usually we separate the feet into 3 different parts. So the forefoot, the midfoot, and the hindfoot. We usually say that bunion is actually at the front here. So it's part of the forefoot area. Plantar fasciitis actually runs from the heel all the way to the front part of the foot. But most common pain area is actually over here at the heel area.
Which key joints are affected during walking?
One of the main joints that we always focus on is the ankle and also the big toe joint. The ankle is one of the major joints that helps to give us the stability when we walk. And then the big toe joint is where we need to push off. For the ankle, if it's actually not stable, it can actually lead to the midfoot and the forefoot being too flexible. That's why for insoles, whenever we prescribe insoles to patients, we actually look for the whole part of the feet rather than just focusing on the arch. Yeah.
How does the choice of footwear affect common foot issues?
Poor footwear usually is actually the width of the shoe and also the support of the shoe. For shoes, we need something that is wide enough for our feet. So if the shoes are tight, you will see that this front part of the shoe, usually the top part is quite flexible and soft. Whenever we wear tight shoes, we may not actually feel it, but if the moment you see that your feet is actually coming out from the shoe, it means that it's a tight shoe. So then it's actually causing a lot of pressure. And then for support of the shoe, looking at this part of the shoe, which is called a midsole. When we test the shoe, we actually twist the shoe to see whether they are twistable or not. So if they are firm like this, where you cannot actually twist it with your hands, that means they actually have a good support. And the other part of the shoe that we actually look at is the heel counter. So if we have something to help hold on to the heel area, which is the ankle, it actually helps to give more stability. So then if a person that rolls in, which we call pronation, they pronate too much, then with a good support shoe, it actually helps reduce the pronation effect. So like example, this one would usually be the ideal position, but when we walk, when they roll in, it's called pronation. For high arch feet, they tend to roll out, which is what we call supination. So then the rolling out would be like that. Over supinate, then over pronation. So a lot of people with flat feet, they tend to over pronate. The other thing that I always like to look at and emphasize on is actually the good rocker at the forefoot area. If we have a good rocker at the front, it actually helps you to propel forward better and smoother. So then your joints don't need to move. You won't overstrain the front part of the feet. A good rocker is something that has a good curve at the front. And it should have a bit of a bounce rather than just a flexible type of shoe, so that the bounce actually can help with the propulsion.
How do Anothersole shoes support individuals with bunions or flat feet?
So for a lot of patients, they always like to ask shoes like Anothersole whether they can wear it or not, because it looks nicer than a sport shoe, which is true. We can't wear sport shoes for all events. So if we do need to wear something nicer, I will always tell patients to try to get something that has insole friendly. So for Anothersole, good thing is that you can remove the insole, and they have a lot of room inside. So that's where you can put your custom insole in there to actually help you to support the feet. And the good thing about Anothersole is the softness of the upper. When the shoes are soft enough at the front, at least they don't put too much pressure. And the other thing is that it's wide enough. If you compare the width of this Anothersole and here, right, it's actually almost similar. For patients with bunion or bunionettes, they actually find this a bit more comfortable because it's the soft upper and wide width.
What are your personal opinions on Anothersole shoes?
Yes.
This particular pair is your shoe, right?
Yeah, this is my shoe, and this is my insole actually. So I made my own insoles for myself, and this is the addition that I gave myself. Yeah, then I fit this insole in here and wear it out for days where I need to look nicer. I like the soft upper because I myself have bunionette and bunion issues, so it fits nicely for my shoe. If you have a shoe that is not wide enough, like I mentioned, right, when the shoes are not wide enough, our feet tends to push it out. But just nice, this width is actually okay for my feet. That's why you don't see any deformity of the shoe upper for my feet. The wide width actually helps for myself if I wear it for long. Yeah, I think that the soft leather actually helps. So when it's soft, it doesn't, the pressure on the joints are not as big.
Why is moisture-wicking technology important in footwear?
Moisture-wicking to reduce the growth of fungal and bacteria. So then it actually helps for people who tend to have fungal infection on their feet, like athlete's foot or even fungal nails.
What key features do you look for when recommending shoes?
People with pain definitely needs to look at a good supportive footwear. If they don't want to compromise fashion, they want something that's more fashionable but still have that support, then that's where the customized insole comes in to go in with the shoe. As long as the shoe is insole friendly, like this kind, we can put insoles to help to give that support that they need. A lot of people actually likes to ask us questions like, what's the difference between your insoles and outside insoles? Like, they look the same. They look exactly the same. Looks can be deceiving. So insoles, if you compare original shoe insole, custom insole, there's actually a difference in the shape. Like example, this one is good in the sense that they give that cushion. They give more cushion on the heel, which is where we need, because the cushion helps with shock absorption. They give a bit more over here to create that bit of a arch support that people always tend to keep wanting. But it's usually not enough for people who actually have foot pain. So that's where the custom insole, that support comes in. So the insoles is personalized to what the person needs for their walking. Also helps to redistribute pressure and also help to have a good smooth toe-off propulsion with the heel area, and then the arch is actually over here on our foot. So when there's insoles, they will actually help you resist that motion, that overpronation motion. So like example, if you look at it, I want to press down, I also cannot press down. For people without pain, this is actually still quite good because it's soft and cushiony, which is what we need in general for walking. Yeah, we need that cushion. But if they have pain from their high arch or low arch, then that's where they need actually a customized insoles to actually help create that support that they need. As long as you have no pain, this is okay.
What general foot care tips do you suggest for maintaining healthy feet?
For healthy feet, actually, the main thing is to check the feet every day. Check the feet every day to make sure that it doesn't look odd or doesn't look different. And then also change the socks every day. When you change your socks every day, hygiene, reduce problems like tinea, the fungal infection. Wear good support shoe all the time. Because with good support and wide width shoe, they can actually help to reduce a lot of muscle strain and a lot of joint problems too. Yeah.
What foot care tips do you recommend for keeping feet healthy?
The problem is that during summer, a lot of people likes to wear slippers. Yeah, during summer, they like to wear slippers. Then that's where problems may arise. Because with slippers, they don't have anything. No support at all. So then they wear slippers every day. That can cause problems.
Podiatrist review on Knotty Sandals.
It's a bit better than normal flip-flops because at least this is thicker. So the rubber is thicker and this part is quite cushiony. So it helps give a bit more cushion compared to normal flip-flops. The arch support honestly depends on the person's feet. It's a bit mild on towards the milder side. For people who doesn't need a lot of support, they would think that it's okay. Yeah, not everyone needs a lot of support anyway. Yeah.
What should you be mindful of regarding foot issues?
As we age, a lot of wear and tear and overuse of the muscles. Good footwear, like a good supportive shoe, is important for them, and actually even for everyone. Yeah, so that we can prevent all these problems like arthritis and overuse injury.
What should I consider when buying shoes?
Look for something that is wide fitting. Whenever you wear shoes, make sure that they don't come off. They don't press the front of the feet, and also a good supportive shoe. They can actually consult professionals like podiatrists or physio or even doctors on foot health. So if they come in with a condition, usually there will be a consultation where we ask more detailed questions to actually get the gist of what happened and what might be part of the cause. And then after that, we'll assess the feet, then get them standing to check their normal stance and their normal gait. So look at static and dynamic. And then after that, we'll actually formulate a treatment program. They may need some exercises to help them, and then most of them actually will need the insoles to actually help to give them the ideal way of walking, and then help with smoother movement for their walking and even their activities. I actually make the insoles in the clinic itself. So we actually hand custom make this insole. Example for this shoe, right? Look at the shape, and then we'll cut according to the shoe shape. Once it's cut according to the shoe shape, it should fit nicely, like this insole, where it fits nicely into the shoe and shouldn't actually feel any insoles coming up. And also they can look at websites, trustable websites that actually talk about foot health.